My name is Susan Frankel, and I'm the CEO of the National Runaway Safe Line. We're excited to be here today and excited to be working together with Family Youth Services Bureau to host this panel conversation, an important conversation about how do we all continue to work together to develop and implement and embrace strategies that focus on preventing youth homelessness and helping to prevent continuing episodes of runaway experiences for young people, as well as ensuring that we are well positioned to be providing crisis services and support and other kinds of early intervention and early prevention opportunities and access to resources for young people who need us. The National Runaway Safe Line is just a reminder, if you are not familiar with us, but if you are, just to do the quick who we are based in the city of Chicago, but we are the federally supported national communications system for runaway and homeless youth in this country. And we are just in the midst of celebrating our 50th year in existence and in providing services to youth throughout our tenure as an organization. We focus on providing crisis services and support through a hotline and a menu of digital online services, as well, that operate 24 hours a day, 7 days a week. And we primarily focus on supporting young people ages 12 through 21. In addition to that, we focus very heavily on our prevention, engagement, and education and outreach activities, some of which we're going to share out with you in just a moment. But with that said, I want to get to the heart of this conversation and be able to introduce all of you the exciting panel that we have assembled for today. But first, I have the absolute honor and pleasure to introduce all of you to Debbie Powell, who is the Deputy Associate Commissioner and currently also the Acting Associate Commissioner. I personally have had the honor to work with Debbie for the last 3 years or so, and have continued to just be inspired by her passion and commitment to the young people that we serve, and for the work that not only the Safe Line is doing, but the work that all of you are doing across the country, and many other service providers and other folks who are so committed to homeless youth. You set the bar, Debbie, so high. And so we are just so grateful that you are part of the work that we are doing as well. But I will turn it over to you.
Thank you so much, Susan. And I feel exactly the same way about your leadership. Your vision has really propelled NRS, the National Runaway Safe Line, and I so appreciate you and your staff. So thank you for that introduction, and good afternoon. So yes, I am currently wearing both hats as senior leader for the Family and Youth Services Bureau. I am the Deputy Associate Commissioner, but I'm now also the Acting Associate Commissioner for the Family and Youth Services Bureau, known as FYSB. FYSB administers 3 grant programs, one of which is the Runaway and Homeless Youth Program, the program which we are focusing on today. I welcome each of you to our roundtable discussion, Research and Practical Strategies. First, let me again thank the National Runaway Safe Line for hosting this very important discussion, focusing on research and practice to inform service delivery, as well as technical assistance resources for the Runaway and Homeless Youth Program. Today's panel will also reflect on the homelessness experiences shared by the youth who participated in our first roundtable discussion in July. Creating sustainable change to address youth homelessness and runaway incidences requires evidence-based interventions and prevention strategies, as well as creative approaches. Sustainable change also requires collaboration with communities to support youth beyond only stable housing. Addressing youth homelessness must recognize that homeless youth need access to education, a living wage job, healthcare, and a caring adult. A quality relationship with a caring adult in an effort to move out of homelessness. We recognize that we must connect youth voices to these efforts. Today's discussion will walk us through existing research and practices to make us think about ways of closing the gaps and making the change needed to meet the needs of homeless youth. It is crucial that we are aware of and understand the impact of the systemic changes, challenges, and adversities affecting homeless youth. And we work together at the federal, state, and community level to foster change. As adults, many of us have never experienced homelessness. And I realize it is vital, once again, it is vital to engage youth voices in developing our solutions. So my hope today is that the discussions today will increase our awareness at the federal level, at the community level, and help us determine each of our roles in preventing and ending youth homelessness. I thank each panelist who have joined us today. Thank you for taking time out of your schedules on this very important discussion and issue. Thank you for sharing your expertise and promising practices with us today. I am personally eager to learn about your work and what can inform our federal practices and help us to rethink youth homelessness to advance the runaway and homeless youth field. Once again, I am very happy you have joined us for this roundtable discussion. And thank you for inviting me to welcome all of the participants. I now turn it back over to Susan.
Thank you so much, Debbie. What we're going to do now is I'm just going to do a very quick introduction of the panelists so that you're aware of who is joining us. But we're going to kick off the discussion after I do that with Dr. Forrest Moore from Chapin Hall and myself. We're just going to share a little bit of an introduction to data and a data report that we're very excited to share with all of you that the National Runaway Safe Line in partnership with Chapin Hall will be launching today. But I do want to make sure you are introduced to the other folks who are joining the panel and around the room as we do that. Dr. Forrest Moore is here with me from Chapin Hall. You'll be hearing more from him in just a moment. I want to just recognize that Dr. Risa Matthew is also joining us. She's the director of the Division of Evaluation Data, Policy, Family, and from the Family and Youth Services Bureau. I'm sorry, Risa, the title was a little bit of a mouthful there for me. And then we are honored to have Jack Martin joining us. He's the director of the Clark County Department of Juvenile Justice Services. We're very excited to have him. And then I know she will be joining us shortly, if she's not here with us yet, is Sam Batko, who is a senior research associate from the Metropolitan Housing and Communities Policy Center with the Urban Institute. You will get to hear much more from all of them momentarily and less from me. But as we are going to jump into kicking things off here, we are very excited to have worked closely with Chapin Hall for the second year to bring together and to take a deeper look at the data and the demographics and the information that we're learning from the young people and families who are reaching out to the National Runaway Safe Line for help. And so for today, we are excited to be releasing a copy or releasing our 2020 Crisis Services and Prevention Data Report that is taking a look at a set of data, so a set of looking at crisis information and crisis logs that have come into the Safe Line from our hotline and our digital services, including email, our crisis forum, as well as our live chat, and to give us an idea of what is that information telling us about who is reaching out to the Safe Line, what kinds of challenges are the young people who are reaching out to us facing, what might be some things that we can learn from that data to tell us more about how might we do a better job, not only at the National Runaway Safe Line and providing the support and services that they may need, but also sharing some of this information and data out with the field more broadly, as we think that there are some very valuable lessons to be learned. We also really took a look at the potential impact that COVID-19 certainly has had, or the pandemic over the last year and a half, now almost 2 years, has had on this population that we serve. Please note that this was not a study that was conducted specifically connected to COVID-19. What we're able to do is take the information and the learnings, and certainly Dr. Moore can speak more from a research perspective on this, but it gives us information because we're able to look at what happened in 2020 versus 2019. We can't completely draw a research conclusion that it's due to the pandemic, but we certainly know that some things have influenced what we are seeing among the data, and we're able to share that out and talk about that more deeply. I'm going to turn it over now to Dr. Moore to let you speak a little bit more to both who you are, what you do, and some of what we were seeing in this report.
Okay, great. Thanks, Susan. Good afternoon, everyone. Forrest Moore, a policy fellow at Chapin Hall. And I'll start by saying I deem myself as a recovering researcher, studied and trained as a researcher, but I'd say a good part of the last 10 or 15 years, I have spent more time in spaces and practice doing a lot of research translation. I have, for the most part, been a youth advocate throughout my entire career, and so I've spent a tremendous amount of time at how young people navigate and negotiate systems. And many of these systems that we all are familiar with, from school systems, child welfare systems, as well as many systems of support that are established in context in those communities where young people come from. And so my lens is always looking towards the idea of what Commissioner Powell mentioned early, is hearing from those that are having those experiences, I think provides the greatest amount of understanding and context. And then where we can, doing and bringing research and data forward to make more meaning and understanding from what we understand those that are experiencing these conditions that we're sort of observing, clearly is one of the better ways of trying to make sense of some of the things that we see in society, some of our ills in society, because historically the voices aren't always heard. I, again, being an advocate for young people, don't like to stop with just the voice, but the active engagement and sort of full participation. And so a lot of my work at Chapin Hall has been anchored around participatory action research, be that with young people and then with community, to truly be able to understand these things that we say we understand. And oftentimes for those of us that study work, get these sort of terms as experts, but I think the true experts are those that are sitting in the work and in that context. And so any way to amplify those voices become critical. And so that's kind of who I am in this work. I have a portfolio of work that sits at Chapin Hall, many of which sits inside our ending youth homelessness work. And so I am the PI for what we call our upstream work, and that's work in San Mateo County in California, as well as in Minnesota. And this work centers around prevention. And so that's another sort of topic that has come up, but Commissioner Powell was talking about this work that is becoming incredibly important. And it's really the idea or the impetus here is to do early identification of those critical risk factors that could lead to a young person having to deal with or getting confronted by homelessness, and trying to mitigate those risk factors early. So that then, the idea is to eliminate the concept of a young person having to experience homelessness here in this country or anywhere for that matter. A lot of this work that we've learned from in upstream work came from Australia, from the Geelong Project. And so there's evidence that these types of approaches work. And so we're doing our best effort of working and partnering with schools and CBOs in those sites to essentially try to understand how we can mitigate and prevent young people from having these experiences. And so that's a little bit about the work. And so Susan, how do you want to shift? You want to go to the report? And I'm happy to share sort of my immediate response to this report after having an opportunity to sit with it for a little while.
Why don't you go ahead and do that? And then I can, we just have a few minutes to do that. And then,
For sure.
and then I can share just real quickly then the pieces. You and I talked a little bit this separately in terms of where we're really focusing for the
Yeah. So I won't steal your thunder, but there is.
Oh, no, you're good. Go ahead.
There is a piece in there that I am completely fascinated with, and I'll leave that for you to tease out a little bit more about the age of the young people that are coming to the site and to the Safe Line. But even along those same lines, one of the things that I found fascinating in the findings is around our conventional forms of communication are shifting. And the numbers in this report sort of speaks to it. The idea of how we make contact with people is sort of shifting and moving. And, to get to a place where I think it was 53% of the people in contact used the chat services as a means for making contact. And, I can only reflect back to a time where, for me and myself, thinking about how to engage, typically it was done live and in person. I know the pandemic has challenged us all in that way, but separate from that, I think we saw a trend even before COVID with how we're able to make contact and reach people are considered non-conventional, where I would say are becoming much more conventional. And I think that was one of the findings that fascinated me, is this idea of virtual support. And again, the pandemic has only made that more accessible and more feasible, while at the same time, we grapple with this concept of access, right? And not everyone is able to plug in via technology. And in considering the fact that we're thinking about a vulnerable group of people who may or may not have access, then as these conventional ways of making contact sort of emerges, we have to give full consideration of those that may not still have that access. And COVID has done that for us in some ways where we're seeing things that I think historically we had awareness of, but oftentimes in crisis, it sort of shines light on areas that we must consider to continue to improve and think about how do we sort of sync up. So that's one area that sort of jumped out at me. And then the other was the percentage of young people who are actually still at home.
Right. So
during this time of making contact to the Safe Line. Yes, go ahead, Susan.
No, I was going to say that's actually been a key point that we've been talking pretty extensively about. We have traditionally seen from our data that we have a fairly significant number of young people who reach out to the Safe Line who are still at home or who still are housed. But this report highlighted, again, just a much higher number and a growth in what we are seeing which is essentially showing that 81% of the youth who contacted us were still at home, and really, from our perspective, present such an opportunity around prevention and early interventions that really link young people to resources available and families available in their communities. I do want to, just as a side note, share with folks, I know that the NRS team has posted a link to the report so that it is available, and it is on our website, and there's lots of great information. We're just right now pulling out a few key points of it, but there is much more that we could spend and talk about, but want to make sure that folks know that this report is accessible to all of you.
For sure. And there's a lot of richness. And so I encourage, when folks have an opportunity to really dig into it, as I would imagine the experience that I had, just sort of seeing it and then seeing the numbers, some things jump out, and consistently from your experience, you say, okay, this aligns. But then there are some things that sort of stand out and it sort of gives pause because it's sort of counterintuitive. One of the things that I appreciated, and again, going back to what Commissioner Pyle talked about in this notion of advancing the field and creating access to new information is how we do that. In studies like this, where data is explored and presented so that we can all have an opportunity to unpack and ask ourselves these questions. So as Susan mentioned, I would not go so far as to make any conclusions based on what it is that I've seen, but what it does for me is it makes me want to ask many, many more questions. And I think in that attempt to ask some of those questions, I think it impacts how we work, the proximity in which we work, and then how do we engage, especially the voices and the young people who may be actually having these kinds of experiences to really make sense of what we think these numbers are. One of the things that I was fascinated by was the number of people who've come to the site in 2020. And I believe it was something around 432,000 or in that range, but just a tremendous amount of traffic. And so what that tells me, at least just as an onlooker, in my immediate response is that because there was a direct engagement with nearly 40,000 folks that came into the Safe Line, 430,000 people coming to the site sort of shows that there are a number of things that we can do to, one, improve how we engage or create access for those that want to engage. And then if there's any way at some point to get any indication as to our needs still being met. So of those 432,000, how many folks were able to get some concept of the services or answering some form of a question that led them to the site, which is, to me, just a tremendous space to sort of think through and to build another body of knowledge and understanding. And so that's another area that I truly found fascinating.
No, absolutely. I think just our timekeeper is doing her job and letting us know we're gonna move on a little bit to the panel, but I do want to just quickly make sure we highlight for folks because I think it's relevant as we dive into more of the conversation. There were a few key things that we did highlight in the report that we believe were somewhat impacted from the pandemic. And I just want to kind of point those out or just note those quickly. Dr. Moore had sort of given a teaser that we were taking a harder look at the age of who was reaching out. And one of the significant components or significant data pieces that we saw and we want to continue to discuss and look at and have conversation about. I'm not sure the slide is as visible as it needs to be, Jeff, or there we go. If we can try that again, I think there's an issue with the slide. If we can't do that, I'll just be able to kind of walk you all through it. There we go. So just a few key things to touch on here in that we were seeing, as you can see, this context under the age of 15 had increased by 53%. And when we looked at the numbers, when we look at the number of young people under the age of 12, that we saw that number double as compared to the previous year. So we could spend an entire panel just having the conversation around why or what do we need to be aware of or what do we need to think about. But we do need to think about sort of the critical nature of that age range, the youth, the opportunities that we have at an early place in a young person's life, the opportunities to potentially work with the family unit more broadly, and just really recognizing what some of this may lead to either in the future or what's really happening with some of our young people right now and the impact of COVID. As Forrest had referenced earlier, we certainly saw this increase in the use of our digital services, in particular our chat services. Not entirely surprising given how young people generally communicate and are much more inclined to use online systems and more digitally based or even social media based ways to communicate versus calling a hotline. So again, we're taking that to heart in terms of how we provide the services that we deliver and how we provide that access and information to young people across the country. And then here, not surprising, but actually, again, an increase for us that 88% of the youth who had reached out to us and were looked at in the data report indicated family dynamics as reasons for reaching out. And then we just want to jump to that third bullet point around mental health being cited as a reason, increased for us by 30%, aligning with what we're hearing across the board in conversations in many different places and spaces across the country and really across the world relative to the pandemic, but something that's really important from my perspective and from the Safe Lines perspective to pay attention to and to be aware of as we move into future conversations and conversations around prevention. So with that said, I am going to bring our panelists together around our virtual table, if you will, so we've got Mr. Martin here and Dr. Matthew and Dr. Moore. Unfortunately, I just was given a note, Sam Bacco, who was supposed to join us, we know did have a family emergency earlier, so unfortunately looks like will not be joining us, but that is okay. While we will miss her and miss her being part of the panel, we have this amazing expertise to draw from, and so let's go ahead and just jump in. We've heard a little bit from Forrest, but I want to provide Risa and Jack the opportunity. Why don't we just start with a little bit more about why your sort of vision and how your work fits into this conversation around ending youth homelessness, and sort of what brings you here today besides us just inviting you to the panel, right? What's driving that passion? We heard a little bit about Dr. Moore's work, but maybe sharing that out from each of you. Why don't we start, Risa, with you?
Sure. So thank you, Susan. Good afternoon, everyone. And for those of you who don't know me, I'm Risa Matthew, and I serve as the director for our division, the newest division in the Family and Youth Services Bureau, which is the Division of Evaluation, Data, and Policy. So as you know, it's a new division. Prior to that, I served as the director for our Division of Adolescent Development and Support, or DADS, which was, as Susan said, a mouthful. And so with that, I had the opportunity to serve as the director for the Runaway Homeless Youth Program, as well as our Adolescent Pregnancy Prevention Program. So that's where my passion continues to lie in terms of the Runaway Homeless Youth Program. Under this current division, I have the opportunity to look at and work with the data that we collect as part of the RHY HMIS. Also to look at how we leverage those data to inform programming and policy. And so very excited about that opportunity with this new division, but also looking at the work of policy and how we can look and analyze policy, not just for its intentionality, but what are some of the unintentional consequences that we see with some policies that impact youth and young adults. And so I would also like to extend my thank you to the National Runaway Safe Line and to you, Susan, under your leadership, as well as to Anna Cody for inviting me to this very critical discussion. I believe that when we engage in these types of discussions, along with hearing from our youth voices with lived experience, we can then leverage these interactions that can lead to strategies where we, I think, can continue to improve services and supports for all youth experiencing housing instability and homelessness. So I'm very happy to be a part of this discussion today. And I think I'll turn it over to Jack.
Yes, thank you.
Thank you, Doc, and thank you for inviting me. My name is Jack Martin. I'm the Chief Probation Officer in Clark County, Nevada. That's Las Vegas. You asked what brings the passion to the subject matter. Well, I grew up as a foster kid. I grew up in the juvenile justice system. I grew up in a very challenging neighborhood, South Central Los Angeles. So this has been something I've wanted to address for many, many years. And it's also something at the juvenile justice system, we tend to be the end of the line. So when many other systems fail children, especially young men and women of color, they land in my department, oftentimes unnecessarily, oftentimes being leveraged into my department. So as Clark County, we made very intentional steps to address these issues by investing upstream. I heard Dr. Moore refer to upstream a few minutes ago and during his presentation. And if there's something that we are trying to do here in Clark County is put ourselves out of work. While I couldn't be a dancer or a raider, I probably could do something, along the lines of trash pickup or something along those lines. But I think the reality for us is this is the work. Intervention is cute. Probation work is nice. I mean, it's nice carrying around a badge, but the reality is the real money is made in the prevention and investing way, way upstream. So that's exactly kind of where our focus is.
Great, thank you. What I want to just kind of take that and take everything that the three of you have shared about what you do and sort of leverage that during the youth panel conversation that we had back in July, when we had 9 young people sort of share their perspective and gave us some great insight into everything that we either didn't know or we should have known or should be doing differently, which is always the case. You talked a lot about that there just seemed to be a broad lack of an understanding of what services existed and how to access them and then sort of who they should go to, right? That they felt like they would go to people who they trusted in their lives, and then sometimes they weren't able to get the kinds of services and resources that they needed, or that adult in their life, while they were willing to help, wasn't sure either, right? How to steer them in the right direction. So one of the things is, does this resonate in your experiences? All three of you are really coming at this conversation from different perspectives, but how does that resonate? And how do we think about that and take some of the learnings that you are seeing in your, from sort of the adult world and the system world and the research world, and apply that? They're all saying, look, we couldn't even find the help that we wanted. So how do we start that as this conversation? How do we do better? And what are some effective things that you all are already seeing that exist? Somebody can jump in, or I can just go ahead and call somebody.
I got to be honest with you, Ms. Frankel. Whenever I hear somebody say that the services are there in the kit, I don't know where the services are. What I hear, what my translation is that we've got apathetic adults who don't want to spend the time to grab a hold of that baby and get them to the resources they need. Because the reality is there's a lot of resources. There's a lot of resources. They might not be the perfect resources. They might not be great resources, but they're there. And what I've noticed and what I've seen in Las Vegas, and we have a lot of kids that land in the bright lights of Las Vegas from other jurisdictions. And what we have had to find is, naively, I believed when I was younger, the more people that knew, the more people that cared. And that just hasn't proven to be true in my experiences. So what we've had to really do is educate adults and really challenge adults, very at their core belief systems, that these are children, these are our babies, what are we going to do other than push them to another wrong door? So, I mean, once we get past that conversation, then I think finding the gaps in the gap analysis is the great part. But we have to start at a place where we have to assume that adults don't care, as long as it's not their children, and that we need to find ways to leverage that and get adults motivated and activated to get in this space.
Dr. Moore, did you want to add to that conversation?
Well, absolutely. And thanks, Jack, for sort of teeing us up. But I think there's a number of things, and being able to understand, one, how do young people come to these services? It becomes really critical, as Jack mentioned, because oftentimes sort of the passageway or the entry is through an adult or another human that would sort of create these access points. And so thinking of ways to bring access closer to young people, I think the demonstration, and again, not to do sort of this shameless pitch for the Safe Line, but I think there's
It's
something.
okay, we'll take it.
There's something that we've learned in looking at that data, right? Like young people are finding ways, to seek out these things, and what we would again say non-conventionally, by finding them early. The idea that someone at the age of 10 or 12 could sort of access a service based on a need that they have identified. And so there's some complexity in that I think is worthy of sort of teasing out, but at the same time, recognizing, creating these access points that doesn't always sort of sit with a gatekeeper, because there are so many things that we would need to unpack around then who is the gatekeeper. We know that this is a nation that's rich in resources, but they don't always seem to get to the folks that need them the most. And so there's some things in there that we would also want to be able to unpack. And there's people who are thinking about this in ways of technology. And I think technology is one sort of medium for doing that and creating access without bias, where people can explore what's out there and what's offered to them. But even in that, there's this idea that people think if we build stuff, people will just come to it. And I think that's couldn't be more false, because after exploring and looking at just a laundry list of services that are offered to youth and families across this country, many for which are highly underutilized. And so we have to wonder then, how do we learn how to meet people appropriately where they are, without this idea that because we have services, then therefore they're accessible and usable. And so really sort of unpacking this concept around how do we reach people and make those contacts. So some of the things that I've seen in the work that has helped in that, not only by way of informing and communicating. So truly thinking about how do we get the services to people, but how do we explore and explain what those services are to communities, and how do we reach them, and using partnerships to do that. So we all know that typically the first place that people go when we're talking about young people are school, because for as long as we have compulsory education, there is an expectation that young people are in schools. COVID makes that a little complicated because physically young people are virtual and in many different ways trying to attend school, but creating partnerships with schools and opportunities to allow for this information, or schools potentially to be conduits to share that information. Because one of the things that I recognize, especially for young people who potentially may need the support of these services, is this concept of agency. And oftentimes there is no voice, or young people don't have that sense of agency. And so how do we create that space to build that agency? And sometimes it's through those partnerships, be it school, our CBO partners, people who are doing this work all the time that may not often have all of that information, using these partnerships to sort of push information out to create access. I think then begins, that next step towards utilization, not even getting into quality. Like we don't have time to unpack. While there's a laundry list of things that are out here, not everything is at the highest level of quality. But in order for us to get to that place, we have to get those things utilized so that then we can understand the impacts of these services that are offered to our young people. But for me, it really is really unpacking and trying to understand best, how do we meet people where they are and mean that? Not just this idea of acknowledging it, but truly meaning it and getting proximate to understand that. Because I think context drives, some of that, depending on where people sit, will determine how they're able to plug in.
Yeah, and I think that's a really important and key point. It's conversation that we're having quite a bit through the Safe Line as we look at being on platforms, communication platforms, things like TikTok, Snapchat, YouTube, spaces where maybe I don't necessarily spend my time, but this isn't about me or my demographic, right? It's
For
to your
sure.
point, it's reaching young people in the places and spaces where they are. I want to let certainly open the conversation to Dr. Matthew and let you share your perspective on that, and maybe also just as we kick that off, talk about if there are some particular services or programs that you're seeing that are been most effective at actually doing kind of what we're talking about, right? Being more responsive, being more effective around prevention and meeting young people where they are.
So, and thank you again. I definitely agree with both Forrest and Jack in terms of the resources are there, some of the services are there. We want to make sure that these services are developmentally and age appropriate, but also culturally and linguistically appropriate for young people. If they're not going to use it. In addition to that, I think it's making sure that the services are in the communities where they're most needed. And I think there are some gaps there where we find that young people and their families have to leave their communities in order to access some of the services that are available to them, which again, I think we listened to looking at the young people and they talked about transportation being an issue for them or barriers to receiving services. And if they can't leave their communities to get to the services, they're not going to utilize them. I think that they talked about the use of Google to look for information about services. And so for me, it's really looking and hearing from the youth, what are some of the key search terms they're using to make sure that we can link a lot of the services that we provide through our Runaway and Homeless Youth Training and Technical Assistance, and of course, through the National Runaway Safe Line, so that youth can access these resources. I don't think people recognize how much of what types of services you do provide, Susan, through the Safe Line. So for example, I know you guys have a very vast database of all the service providers across the nation. And so having youth be able to get that or access that information to access services through the National Runaway Safe Line, I think is very critical to doing that. I think we talk about school systems, and I think how do we continue to build relationships with the McKinney-Vento liaisons to be able to reach youth in the school system. You know, mental health, I think, is one of the issues that comes to the forefront when we talk about pathways into homelessness. And I think we understand that it's not just on the parent or caregiver, but the young person as well. And how do we make sure we get them access to those services, whether it's mental health, substance use, and as well as the other support services that they need. In terms of looking at prevention, I think going back to your second question, I know that Susan, our Basic Center program is required to provide emergency shelters to minor youth, but this funding also has an option to provide home-based services, which we consider our prevention services to youth and their families. And so I see this as a promising practice, but I think there's more that can be done to learn more about the home-based services, because I assume there are multiple variations in terms of how this is being implemented. But I think we can do more to explain or explore what are some of the therapeutic modalities that work and for which subpopulations of youth and their families. So for example, what impact does licensed family therapists or other licensed practitioners bring on mitigating adverse family dynamics and preventing runaway episodes? Because I think we've learned that one of the key pathways into homelessness is looking at family dynamics, such as family conflict or caregivers asking youth to leave the home. And so I think that looking a little bit more in terms of how we can continue to explore prevention services before there's a runaway episode, I think is very critical to the work that we're doing and part of this discussion.
Great, thank you so much. Jack, I'm gonna put you, kind of put you on a spot, not quite, but a little bit here. I had the opportunity to hear you speak at a meeting in Las Vegas, where you were also part of a panel with folks all from your county or area, but maybe sharing out a little bit about what you all are doing. And I know you have some just such an interesting perspective on prevention, particularly given right where you sit in your professional life, which is on the other end of the spectrum. But maybe just share a little bit about the strategies and things that you all are looking at as well.
Thank you, Ms. Susan. I think the reality for us is when we kicked off, we call them our juvenile assessment centers. We were we were very intentional about what we needed to see. What we were seeing in juvenile justice was a young African-American male was 11.5 times more likely to be incarcerated in our institutions for the same crime as somebody who looked like me. So when we drew that down, we started to understand, well, first of all, we all know that Black folks are not more criminogenic than white folks, but they are, for whatever reason, landing in these negative systems, right? And we all know the reasons, and all of us know the reasons. We can sit around and we can pat our foot and write a blues song about it. We just choose not to address it. So in Clark, we really wanted to understand where those first contacts were happening. And then we wanted to address, like when I speak nationally about a lot of issues, and when you ask me how to stop juvenile crime, invest in education. That simple, right? You know, you can close my doors if we actually spent damn near close my doors if we actually spent the money up there. So when we saw when we did the data analysis and we did the research, we really found that we were having issues at our education. So we invested upstream. That juvenile assessment center model was anybody can bring a child here, anybody, a coach, a pastor, a neighbor, a child could walk themselves in. We wanted it to not be a law enforcement intervention at all. It was really kind of saddening for us that we had to drive the conversation. We really wanted it to be owned by the community. We got 14 different bureaucratic organizations, to include our local police, to include our Department of Family Services, which is our child welfare agencies. We got our adult mental health. We got all these partners together. And we created this program we call the Harbor. Because, right, no kid is going to go to a damn juvenile assessment center. Hell, I don't even want to go to a juvenile assessment center, right? So the kids got to name it. They named it the Harbor. Okay, this is where you can giggle. Yes, it is a harbor in the middle of the desert. The kids named it, so shut up. Okay, we'll keep it pushing. We also put them in the middle of our we started off with one. We've now got 5 up and running to speak to the transportation issues. We put them in the neighborhoods that most needed them, where transportation and cost and things were a barrier. All the services there are free. We've served almost 20,000 kids in the 4 years, kids and families, what I like to call my babies, in those 5 years. And we've seen 90% of those children have been diverted from juvenile justice involvement. So what that tells me is that an actual intervention, an actual wrap services model that has no cost, will meet the child where they're at, will be in their home when it needs to be, is close, and actually has one of the biggest parts is we're not just so many of these programs become like card handling. Hey, okay, you've got this problem, go see Reggie. Hey, you've got this problem, go see Johnny. We do warm handshakes. We want to make sure that children are connected. We also don't want to make it super secret probation. I don't want them on probation. The goal of this is to keep the kids off probation. So we made a really a strong investment there. Once we opened that, we then figured out further, which we all knew, but we now could find some funding because we showed a proof of efficacy, that we now invested in a truancy prevention outreach program, which we affectionately call T-POP. No, that is not a Korean boy band. That is our truancy prevention outreach program. So we spend a lot of time now investing even further upstream. What we learned in Clark County, that we had a bell-shaped curve, that as many kindergartners were missing school or being expelled from school as seniors in high school. Oftentimes when we talk about truancy, we think of a guy that looks like me standing behind my Chevrolet smoking weed, not going to class. The reality of it is that many children have massive obstacles to getting to class at a very young age that aren't, wrapped in services or wrapped in, they're wrapped in barriers. So by the time they get to 2nd and 3rd grade, they're behind. Now they're acting out in class. Now they're a problem child. The system has created many of these. So we've further invested in that, and we've served over 7,000 families. We started that in the middle of COVID, which was probably the worst time to start anything. But we continue to invest upstream. What we've seen from the juvenile justice aspect, when I took over the department, we had 26,000 referrals a year. We're down to about 5,000 referrals. We went from 11.5 times more likely for a young African-American male to be incarcerated down to 6.5 times more likely. Still not great, still inappropriate, but we're being very targeted with reaching those very particular demographics. Hopefully that answered your question, Susan. Hopefully I didn't cuss too much.
No, you're fine. No, we appreciate it. I think that the intent of this was to highlight, different models, different strategies, and different ways that we can highlight here and have the conversation. I think to sort of build on that, and you were addressing how you were recognizing starting earlier. And when Dr. Moore and I were talking earlier about the 2020 data report that the Safe Line was releasing today, we did highlight sort of what we're seeing as an increase in the younger aged, right, this younger age of young people reaching out to the Safe Line. And as Forrest had noted, to think about, you know, a 9, 10, or 11-year-old finding the Safe Line, so finding us online and then figuring out and chatting with us for help. That's something, you know, we really are talking a lot about and need to pay attention to. Certainly there's thousands and thousands of other young people that we serve that are 15 and above. I want to be really mindful. It's not that we've completely shifted, but sort of knowing that and understanding that. I don't know, Forrest, if you want to speak more to that, and how just the reaction overall to that, and how we fit that in within this conversation, right, about prevention. Because if there's an opportunity, you know, hopefully if somebody is 8, 9, or 10 and they're reaching out to a crisis hotline, we hope that we're finding ways and implementing strategies and connections for them to get that family support they need.
Yeah, no, it's critical. And I think I'll speak to this in perspective of the work itself and some of the things that we've seen in upstream, because, you know, these are some of the greatest lessons that I feel like have sort of come forward. When we think about taking preventative measures or building on whether it's best practices, promising practices, the context is usually derived from programs, as you mentioned, Susan, that are an older age, young people 15 and older, sometimes even 18 and older, when we're thinking about especially this idea of support around homelessness. And so what we are doing in the upstream work is working with those earlier ages as early as junior high. And so we're doing it in the junior high schools as well as in high schools. And so what's interesting is what we've found out and has sort of been confronted by is that when seeking support for a young person that is in junior high or elementary school age, oftentimes by design, the program focuses on that individual. But what we have found, in order to be effective in this work, it is not solely about the individual, it's the family or the context for which that care is provided. And so sometimes it's not always in our traditional sense of how we define family, but it is that young person's family. So whether that is, you know, a mom and dad, or even grandparents or extended family, kinship in some form, it becomes critical that we think about that young person in that context and not solely thinking about we're just going to link them to services, right? And so in working with our CBO partners, they were at a loss, right? Because by design, they were thinking about, okay, we'll get consent, we'll identify these young people, and as Jack mentioned, create these wraparound supports that essentially should alter or change the trajectory of this young person, sort of putting them on a good path. And that sounds good. But the reality is that these young people are sitting in a family context that requires others to be engaged. And then the other thing that Risa mentioned that, you know, sort of really hit home is then how we even make those connections and communicate. And so in one population that we're serving, it's 90% of our students are undocumented. And so thinking through how to even reach the student and the family has some complexities that are not similar or the same as the young people that are in those same programs in Minnesota. And so really being able to think through how do we serve a family in place or intact, as opposed to thinking solely about the individual, because again, no one grows up in a vacuum. And it doesn't all sort of sit in one place. And so forcing us to think about the complexity of the needs that a person has then means that we have to bring that same level of sophistication in how we deliver our services. And oftentimes, I know we're all restricted, typically by budget and resources and things that sort of stand in the way of doing effective practices. But that can't be sort of the excuse, right? We have to get over the fact that there's always going to be limited resources and reach and an ability to do things. But I think that's where we get committed to this idea of collaborating with others and bringing others into the fold, that where if someone else can provide an excellent service that I cannot, that shouldn't necessarily be seen as my competitor, it should be my partner. If essentially our focus is supporting a young person and their family to advance what it is that they're attempting to do along their path, then we can't get restricted by our ability to collaborate in these spaces. And so really thinking about one, sort of taking a step back and not saying that it's just a person or just a student or just a young person, because everyone has a context and there's some sort of system that sits around them in terms of whether it's the family, traditional or non-traditional. How do we support and not limit our support with this idea that if I can't just reach the young person, then therefore these services can't happen, especially for those that aren't of age that they can consent, right? And so we have to think about, what does that mean? How do we create an opportunity for those services to be provided? That within itself means there's some level of engagement that has to happen outside of just that young person alone. And so those are things that we're quickly confronted by once we got to that level of service, recognizing that, okay, while the model makes sense, and ultimately this young person would need to engage in a number of services to sort of change and sort of increase the likelihood of their success, we need to be thinking about that with a more broader lens around how is success built. And that then became important for us to think about that at the school level. How do we better support the school to bring families forward?
Mhm.
Then even with our CBO partners, how do we then support them to ensure that when serving a young person, they're thinking about it in the context of others in that young person's life? And building on what we're able to learn that way so that it is not so restrictive in its nature. And so, there's varying degrees of people doing it well, right? But the idea is for us to continue to learn from one another so that then we're all sort of moving forward and becoming better in how we serve, and not just resting on the fact that we have the service, but that it's actually reaching the young people and their families in the way that it could benefit.
Yeah, that's great. Thank you so much. Teresa, I want to give you a chance to respond as well.
So I think that, and looking at that report that you all just released, I think one of the things that you all highlighted for me is the age, and looking at youth 12 and under. And for me, it's the opportunity to explore, is there any, and I don't know if you have the data to support this, but can we do it by race? I know that one of the situations that we're seeing that is looking at the suicide and death rate among Black youth. And the younger they are, I think it's, I think we see that the increase in suicide rate, it's been astronomical. It says like Black youth under 13 years are twice as likely to die by suicide. So that's under 13 years. And so I'm just wondering if that is something that's driving youth to connect more with via chat with the Safe Line, because I think one of the situations that I think that we can look to leverage is maybe we have a lot of school systems that have school-based services, and one of the studies that I've been looking at, that schools are actually being the de facto mental health system for a lot of young children. And having the opportunity to be able to maybe leverage some of the resources so that youth who are more likely to use school-based mental health services as opposed to community-based services can get the mental health services they need via school, where it's a safe place for them. Hopefully it's culturally appropriate and linguistically appropriate. So that's another opportunity, I think, that we can explore in terms of how to make sure youth are getting the mental health services they need. Because I think the young people that spoke back in July, I think mental health services was one of the key factors into pathways for homelessness. sometimes it's the parents or the caregivers, but oftentimes it's also the youth and the healthcare needs that they do have. So I'm thinking that, and how do we look at continuing to support that kind of access to services through the school-based mental health services. And so for me, it's also looking at the opportunity in terms of policies that can help the parents or caregivers access mental health services within the community. I think Forrest mentioned it in terms of looking at family structure and the opportunity that youth don't exist in a vacuum and the families don't exist in a vacuum. They're the communities as well that they can use to either access services there if it's limited, but then what are the next steps in terms of community services and the crisis that happens with the Black youth. I think the Congressional Black Caucus had their ring the alarm in terms of Black youth and mental health, and there's the suicide rates. And I think there's a lot of work now being done to support that, but looking at a lot of policies that are impacting Black and Brown communities. And for me, it's, while that is nice, it also has to come with the funding to support it. Because I think we can do a lot of work around policy work and enacting legislation, but if there's no funding to support that mandate, then it's all for naught. So we also have to look at how do we advocate for the funding to support the services and the policies that we're bringing to bear for Black and Brown communities.
So thank you. You also helped to sort of move us into probably what will be one of our last questions. And again, I've got this amazing timekeeper that is sending me messages. So we have some opportunity for folks to ask questions, but one of the key pieces, one of the statements or part of the conversation from the youth panel in July was about how the young people really felt very deeply how the communities that they were from or had ended up in and the public more broadly really didn't understand the impact of youth homelessness. They didn't understand youth homelessness in general, and that really as a collective group, our 9 young people, sort of this really resonated for them about really feeling like this sort of general understanding and awareness, that they're sort of seen as and Jack has sort of touched on this as well, bad kids, not necessarily young people living in difficult or challenging circumstances. And we've had this conversation in different ways, shapes, and form, but kind of to your point, Risa, also, we can talk about things and we can set policies, but how do we collectively really look at maybe recommendations and really pushing the conversation further around community education and public awareness around what it truly understanding youth homelessness and the impact of it. So big question, but a good way for us to, whoever maybe wants to take that first, and that'll lead us into sort of the end, and we'll want to open it up for questions. But sort of addressing, these young people felt very marginalized purely by how they were defined. So how do we begin to change that narrative for them?
So I think you hit on it, and Risa may have touched it at one point too, is that language matters in these things. And unfortunately, not only would I say from a national perspective has youth homelessness gone misunderstood, but homelessness in general, it's like one of those things that it's the obvious sort of elephant in the room. We have all seen or been confronted by, whether it's someone else experiencing it or have experienced ourselves, but no one seems to talk about it. And how do people end up in those particular challenges? And so being able to fully sort of flush it out and what it means. And when we think about it from a policy perspective, right? I mean, just if we were to think about how there's discrepancy across agencies and how it's defined, and being able to address that so that we have some common understanding. I would say it's been a while since I had learned this, but when I was confronted by understanding the concept that couch surfing is a form of homelessness. And not only did that open me up to a greater understanding of the depths and the nuances of those challenges, it was when I then had my own experience realizing, okay, well, I was in that situation at some point in my life. You know, I didn't necessarily define it as a bout of homelessness because it was a place that I felt comfortable. It was people that I knew cared for me, but it was not my home, right? And so there are nuances to this term that I think we can continue to help people understand the complexity of it, because it's not so simple. And as in most stereotypes, we create an image of what it looks like for people. And then therefore, if it's not inside that box or what we see, the way in which we define or have defined homelessness, then everything else just doesn't always count. However, for the folks that are having those experiences, it very much so counts. And so then it's left on those that are having that experience to try to explain or to get people to understand those types of challenges. And it's not always so easily or readily available in ways of acceptance. And then how do we help support the service? And I think one of the things that we could do is in this concept of one, just bringing our full understanding of what homelessness is and the complexity of it, so that people can then have those opportunities to expand their understandings, I think is a tremendous way to sort of help bring some balance to that. But then also confronting some of these discrepancies that we see in our own policies, right? Like if in fact that language prevents us from having one sort of clear understanding, then how do we create the connective sort of components so that people can make sense of it when it's time to operationalize? Because it's not unforeseen that these agencies could have the same provider trying to reconcile two different policies, right, that are coming from these different agencies, but they are the ones who carry the burden of then doing that service and supporting people who are confronted by homelessness, and oftentimes can't make sense of it because they're not fitting squarely in the right box. And so I think we owe that to not only those that are providing those services, but those that are confronted by the challenges of homelessness to be able to continue to flesh those things out so that then we're able to make more sense of them. So that I feel like, it's one of those spaces, but there's so many spaces that I think we could build upon to do better.
Absolutely. Jack, do you want to share any words of wisdom here, insight?
Well, you got me sandwiched in between two doctors, so let's put everything that I say not only with a grain of salt but a pinch of salt. Okay. Well, I think I'm listening to my two co-panelists here, and they're saying some really bright things. But I also believe we sometimes forget the elephant in the room. Like when we talk about education being the place that is where mental health services should be provided and could be provided. I sit here with the 5th largest school district in the country. We're the 5th largest probation department in the country. We've got 320,000 students. And systematically, young men and women of color are systematically pushed out of that educational system every day. So while I 100% agree with the doctors that this is the stuff, but we got to start having some real conversations to adults that are paid by our taxpaying dollars to protect our babies, and they're not. I'm speaking this weekend to all of our administrators within our Clark County School District. I plan on calling bullshit, because oftentimes we love helping the kids that look like us, that act like us, that comply with us. When they don't look like us, when they don't act like us, we've got a separate set of rules. So when we talk about helping homelessness, we know that we've got 6,500 to 7,500 young people, my babies, couch surfing right now here in Southern Nevada. That's not okay. Adults know about it. Adults aren't doing anything about it, and that to me, I'm calling bullshit. We got to get moving. These are children. These are real people with real lives, with real traumas, and I'm busy here doing this.
Yeah, no, absolutely. Risa, do you want to add anything before we we open up? I want to make sure folks have some chance to ask questions.
Yeah, I think that the youth did a really good job in terms of reading the summary, in terms of highlighting where there are barriers and how do we work to make sure that we break down those barriers so that they do feel comfortable accessing services and they don't feel marginalized. I think that we talk about working upstream in terms of prevention, and we talk about working with the family unit. But when we do that, we have to look at addressing trauma experienced as a family, as where the youth have experienced trauma. And I think they talked about that intergenerational transmission of trauma and how do we look to mitigate that? I think that looking upstream, working with family, working with the families in terms of getting access to counseling and therapy. But I think we also have the opportunity as part of our maternity group homes, which work with pregnant and parenting young people who are experiencing homelessness, to be able to break that intergenerational cycle of trauma and working with a young person to make sure that that as they're working to care for their infant or young child, that they do that from the perspective where it's healing for them, but also not inflicting that trauma on their infant or child. So I think those are some opportunities to really look at young people and what they're experiencing in terms of their trauma, whether it's within the family or trying to break that intergenerational cycle in terms of working with the young person who is a new mom or dad and making sure that they get the services they need to break that cycle of trauma. Because I think we also look at that trajectory as we look at family homelessness and young people experiencing family homelessness, where we have situations where if the adults go in, they can't take their children. So they end up leaving their children in a shelter. And so how do we look at family shelters that can take the entire family? I know that working in the past in terms of residential treatment, we had moms who can go in, but their 12-year-old couldn't come with them. And so they had to find a place while they worked on their substance use issues to be able to find whether it's kinship, grandma, someone else to take care of their older children. So I think we need to visit that in terms of looking at policies to support housing and services that can wrap around the entire family. I think that is the opportunity to be able to look at when we look at youth aging out of the foster care system into sometimes homelessness or housing instability, and looking at upstream, what can we do in terms of making sure the transition planning is happening earlier, much earlier, so that they're not transitioning out or aging out of foster care into homelessness. So I have a couple more, but I know that we are at time. So I will pause there and see if anyone else wants to add anything.
No, thank you. And thank you to all of you. I have put a note in the chat that if folks have questions that they would like to ask, please feel free to post them in the chat or raise your hand, if you will, your virtual hand, and we're happy to call on you. So if there are questions that folks have, please feel free to raise those now. I'll give you just a minute. So I was sharing earlier with the panelists that when there's this silence, that I have this habit of starting to just randomly speak, which I'm doing again. But here we go. See, and then someone will ask a question so that I stop talking. So how can we effectively raise awareness and enact change against laws that make homelessness illegal and make it more difficult to end homelessness?
I think that's another one of those questions. The more people that know, the more people that care, right? Well, you know, and know the real story. I know here in Nevada, I know everybody thinks we're like Las Vegas is a pretty progressive city, but we're literally the Mississippi of the West. Once you get 3 miles outside of Las Vegas, it looks like the surface of the moon. And we have our legislative sessions are every 2 years for 120 days. So, what I've found to be the most effective is grassroots organizing and educating. And I call it the crew of 62. I also call it many other things, and you've seen that I cuss, so I'll probably back away from some of that. But I think the reality for us is you have to lobby. You have to lobby, and you have to show data. They want to know, and they want to know how it's going to impact their district.
I just echoed. Go ahead, Lisa. No, I was just gonna say, I just echo what Jack said. I mean, it really is, one, the pressure that we can place as individual citizens and coalitions, groups, with our policymakers, but data makes all of the difference. I recently was just in a conversation with Congressman Davis and some of the state representatives here in Illinois, and despite all of what we talked about, the first response was, where was the data? Right. And so understanding that it's important for us to have that keen understanding of the problem and its complexities, but then also bringing data where data exists to help build on that. Because in order for them to really respond, it's going to have to come from a place of, data, facts, and it can't be just our emotion. And our emotions matter, because I think that's what brings us together. But then we have to substantiate it with data.
So I think you captured what I was going to say in terms of both you and Jack, in terms of the need for data. I think that when we look at policies that are counterproductive to ending youth homelessness, I think we also need to bring the data to show that these types of policies are having a negative impact on the young people that we want to serve. And so granted, the intention, I think, it may be well-intentioned, but I think the unintentional consequences of some of these policies, I don't think some understand. And so having the research to support what youth are experiencing and how these particular policies impact them negatively, I think is something that we can show to or others, I can say, not from my lens or where I sit, but others can advocate for that for the young people.
So I think all important information, and I know that Jack had added in the chat just around making sure, sort of building on this highlighting data argument, just looking at the human kind of cost and the human component to it, tying it back to the real people who will be impacted and affected in your communities. I know that there's this is generating some really good conversation within the chat around investment and how to use the data. I'm just trying to read this fairly quickly. With the data indicating the importance of prevention services, and we'll probably just, in the interest of time, this will probably be our last question. Then I want to make sure we have some time to hear from Susanna Dean as well. But back to the question, with this data indicating the importance of prevention services, is there discussion around increased emphasis on an investment in outcomes associated through the services provided through FISB? This noted that Risa, we think you were starting to sort of touch on this a little bit. Does that make sense? Do you want me to try to paraphrase that question there?
Yes, can you?
Yeah, I think the bottom line is that we're having this conversation, the data is playing out around the importance of prevention and the effectiveness that prevention can have. So how do we do a better job of maybe tying this in with the programs that are being funded through FISB, whether it's basic centers or the transitional living programs or maternal child group homes. Just, how do we make sure that that's coming through in a better way and emphasizing the importance of that investment on the prevention side in the work that's already being supported through FISB.
Right. So, okay. Thank you for paraphrasing.
Yeah, sorry. It took me a minute too.
No.
Great question though, Julie. Thank you.
So I think that one of the things we touched upon is the actual opportunity as an option under the Basic Center program to do prevention work. It's couched as home-based services. And I think that There's more to explore, to look at taking it from a promising practice to an evidence-based practice. And I think evaluation of the Basic Center program as it relates to the home-based services is probably a next step, to look at how they're being implemented, or the home-based services, how they're being implemented. Who are the practitioners working with these families to prevent, while the youth is still at home, to prevent a runaway episode. But then again, looking at if there is a runaway episode and youth are reunified with their family or caregiver, what are some strategies that need to be in place to prevent returns to homelessness for these young people? So I'm looking at it from a primary and secondary prevention perspective in terms of working with these young people. And I know that we work and we've looked at what we call the 4 core outcome areas, looking at making sure youth have safe and stable housing, they have access to employment and or education, permanent connections, and then the social and emotional well-being. And so I think those are where our focus lie in terms of working with the young people and looking at some of those core outcomes for them. And I'm hoping that as we continue to look at our data, RHY, HMIS data, that we're able to tease out some of that, because we do have, I think, the several questions around the permanent connections and our permanent connections demonstration initiative. So hopefully we'll have some information to report out to everyone.
Thank you so much. There really is some very robust conversation that's happening in the chat. We will capture that and be able to share out a summary of the conversation with everyone. I know we could continue the conversation, but in the interest of time, I want to thank each of you, Dr. Moore, Mr. Martin, our honorary Dr. Martin, and Dr. Matthew. It's been such an absolute pleasure having you here and sharing conversation. We could, again, talk for hours. So thank you so much for your time and being a part of this conversation. I also want to introduce folks to Dr. Susanna Dean, who is the director of the Division of Runaway and Homeless Youth for the Family and Youth Services Bureau. She just has a few words to close out the afternoon, but thank you again for being here together, and I'll turn it over to Dr. Dean.
Thank you, Susan. Thank you, Susan, and good afternoon, everyone. I will be brief. I just wanted to say that I have truly enjoyed today's session, and to thank all of the panelists for sharing a wealth of information and practices that really will give us an opportunity to rethink services in the RHY program, as well as prevention efforts. I know that clearly we've heard that there's still a lot of work to be done to help youth find stable and safe housing and supportive services, but also how we build in and sustain positive outcomes for these youth long-term. I know that when we started this roundtable, we had an objective of being able to connect youth voices, research, as well as practice, and with the purpose of finding better ways of addressing incidents of runaway and youth homelessness. I really hope that we've done that today. I think that we have. Our panelists have shared phenomenal insights on what the data and practices are telling us, as well as how this information can be integrated into the RHY program and the role that we play in really rethinking our work towards preventing and ending youth homelessness. I want to share really quickly some of the things that I heard. I hope that you heard some of them as well. If not, to kind of underscore some of the key takeaways from the panelists. We definitely heard that there is a need to explore how to better identify and connect youth and families, specifically elevating the role of caring and motivated adults who have an interest and the capacity to support youth. We looked at opportunities for incorporating the youth voice and understanding how young people come to RHY services, including meeting people where they are. For example, engaging with natural partners such as the school system to increase access. Dr. Moore stated an excellent point when he said, available does not mean accessible. And I absolutely agree with that. We also heard about the importance of targeted focus on prevention and wraparound services to prevent youth homelessness and subsequent involvement in the juvenile justice system. And this includes an increased awareness of complexity of youth homelessness and understanding the role of intergenerational trauma in contributing to homelessness. All very important and key points in the work that we do in the RHY service model, but also opportunities for us to rethink how we can further underscore some of these points. At FISB, we're very proud of the 600 plus runaway and homeless youth programs we have nationwide. Our programs see the potential in each youth and really work to serve them through our service providers in a very comprehensive way, but we know that our service providers can't do it alone. And so with the clear opportunities that we've heard today to build on the data and the strategies, we definitely want to include the youth voice to continue to integrate evidence-based strategies and understand how this impacts pathways to youth homelessness. We want to increase our services, policies, research, and intervention, about how we can be inclusive about the needs of all youth, but also those from underserved populations, such as African American, Hispanic, Native American youth, as well as our LGBTQ youth. And with that, I definitely want to again thank the NRS, as well as Anna Cody for working with the NRS to coordinate this event, and to thank all of our panelists for sharing their expertise and their vision for supporting runaway and homeless youth. With that, I again want to say thank you all for joining us, and I'll turn it over to Susan.
Thank you so much. And just to echo the thanks, we are again so appreciative of the partnership and the relationship with the Family Youth Services Bureau, and so appreciate all of the panelists today, and for Debbie Powell for joining us, and Sanzana Dean, and certainly all of the support that we regularly receive and working with Anna Cody as well. Just a little bit of a shameless plug, just as a reminder to everyone, please take some time to look at the 2020 Crisis Services and Prevention Report that we have released today. I know there was a link that was posted here in the chat, but it's also available on our website. In it, I also will just note, if you weren't able to join us in July for the earlier panel that we hosted, the recording is available to watch and to listen to on our website, and strongly encourage folks to do so. I think that the two conversations are very important in connecting to one another in terms of hearing the youth perspective and the youth voice, which is critical to influencing how we move forward as a community and as a collective network of committed providers and researchers and experts and just general community members to support youth in where they're at and with the needs that they have. So with that said, again, we are so appreciative to have spent time with all of you today and together. And we look forward to continuing many important conversations as we all work together toward the goal of ultimately ending youth homelessness. So thank you very much.